What's up, everybody? Welcome in. I believe we are live everywhere. See Facebook, see LinkedIn, YouTube. What's up, everybody on YouTube? I see you guys are in the comments. Thank you, guys. I see Jack. I see D. Lynn. One Step Forward. What's up? I see Alyssa, who I think is new here. Welcome in, Alyssa. I hope I'm pronouncing that right. So pumped you're here. Welcome to the Performance Medicine Show. We are answering health and wellness questions tonight. I am back in East Tennessee. So pumped to be back. Thank you guys for putting up with me over there in Australia. You guys know the drill. We're answering questions tonight. So if you have a question for Dr. Rogers, go ahead and put it in the comments. Thank you, Orel. Thank you. Great to see you. Grandma Mary, I love you. Can't wait to see you. I'll see you soon. I'm so sorry I missed Saturday. I heard it was an absolute blast. I'll have to make it up to you somehow. And I've already made a commitment. I'm not missing that next year. Welcome in, everybody. I see some people are coming through. Are we on Facebook? Is there anybody watching on Facebook that can let me know that we're live there? And then we'll get moving. I see most of you guys are YouTube right now. Cool. Stan, thank you. Stan's over on Facebook. Thank you for letting me know it's working over there. Appreciate that. This week we had a wonderful week, a really interesting common sense episode. I'll get to that here okay, cool. Thank you, Alyssa. Sherry, what's up? Great to see you. Man, we got a great crowd tonight. If you guys got questions, go ahead and put them in. We're going to get to every single one. We had a few come in throughout the week. So we'll get to those, and then we'll get to the live questions, as you guys know. On the Common Sense MD, this week went out today, I believe this morning. Really, really interesting episode with Diana Harshbarger, who was on the show last week as well. This week, they had a different conversation. This was mainly around, compounding pharmacies. They focused a lot on compounded hormone replacement. If you guys know Diana, her and her husband, her whole family's a family of compounders, and really they played a huge role in getting Dr. Rogers into hormones. And so it's kind of fun to watch them talk, about kind of the beginning of performance medicine, which you guys know is a functional medicine clinic in Tennessee. And Diana is just super knowledgeable. It's just really fun to see a doctor talk with a pharmacist about this stuff. And she gets really, really detailed. If you guys want to learn about, what happens when there's drug shortages, kind of the role of the compounder. One thing Doc said that I thought was interesting is from, he says Joe Schmo in Kingsport, Tennessee to, Johns Hopkins, everybody uses compounding pharmacies. So I thought that was cool, and definitely check it out. If you're interested in, if you go to a compounder, if you're on hormones, if you're, worried about hormones, definitely watch that episode. It was super, super interesting, and a really fun one to watch. Linda, great to see you. I overheard you this morning. I haven't gotten a chance to ask Mom how the show was, but I'm sure it was amazing. Bianca, I was not expecting you live tonight. Thank you for making it. I hope you guys have a wonderful trip in the warmer weather. Robin Riddle, what's going on? I cannot wait to see you this week. Robin's our nurse practitioner in the West Knoxville office, and I'm going to get to hang out with them Thursday. We're going to get some filming. And Robin, if you want to, I know how we work here, and if you want to let us in on what the next couple episodes topics are, let me know. Let the crew know tonight. I think if anybody should know a little early, it's our live Q&A crew. But I'm excited to get to hang out with you guys and record some new ones. We got, let's see what we got. My brother Andy put out a really helpful one. And then I was thinking about Jack actually when I was watching this. It talks about travel tips. Andy, of course, is the host at the Diabetes Tour Guide, and you guys know he has type 1 diabetes and has for I believe 19 years now. My sister has had it for over 20. He talks about traveling with type 1 diabetes and kind of what you need. And I thought about Jack with the question last week around, if somebody has low blood sugar or if there's any sort of situation where if you're with somebody with type 1, what can you do to help? And Andy goes over all that in this one. So that's a good one to share. It's really quick. It's 5 minutes. A lot of the travel tips have to do with, things that you can have, at a party. If you have a kid that has type 1. I'm gonna get moving. I'm getting. They're in my ear saying we gotta move forward. I'm sorry. We're moving forward. That's right, Robin. I'm pumped. I am pumped. We'll know Thursday morning. Let me bring Doc in here. Are you antsy? Are you antsy? You ready to go?
No. What would make you think that?
Sorry, guys. I have to apologize. There's some people here with us live, and I went a little long on our intro, and I did not mean to. So
welcome back to Earth. Welcome back to the U.S. Ben. Last time he was in Australia.
Yep.
And we're glad to have him back. How do you feel? Have you recovered yet, or?
I am fully recovered. I feel great. Got in Saturday. Had Sunday to kind of get my legs underneath me again. But man, it's been wonderful to get back to East Tennessee, and it's Christmas time. It's a little cool. It's nice. It's nice. I associate December with cold weather, so it's nice. It's nice. I'm so glad to be back.
That's right. You said it was 104 degrees when you left.
Yeah.
Sydney?
Yeah. It was hot.
I bet. Wow.
How's your day, man? It's so good to see you. I'm gonna get to see you tomorrow.
Had a great day, a wonderful day. Enjoyed it like usual.
Yeah, good day. It's you pumped to answer some questions?
Yeah.
We're gonna get to questions tonight. That's right. Andy's gonna be on, I think, and I see Katie's comment. He's gonna be on here in the next couple of weeks. I think he's heading to an A4M conference this week, but we're going to get him on. And for all the fans of the Diabetes Tour Guide, we're going to go live on that channel as well. We got Helen from San Diego here. This is incredible, Helen. Thank you so much for hanging out.
I wish I was in San Diego.
I know. That actually sounds phenomenal, Helen. I might like that type of 75, 72, that type of weather. But you guys know the drill. We're answering live questions tonight. All your health and wellness questions with Dr. Rogers. If you have a question, go ahead and put in the comments. We're going to take a few that came in throughout the week. Doc, thank you for the time tonight. We're going to have a blast, and we're going to start with one of my favorite types of questions, which has to do a little bit with getting your nutrients from food versus supplementing. We talk a lot about supplements on here, and this question was just perfect. It was one of those absolutely perfect questions for this crowd. If one egg yolk has between 67 and 192 micrograms of vitamin K2, and I eat anywhere from 1 to 3 whole eggs a day, do I still need to take my supplemental 180 mcg of K2 with my vitamin D? This is a great question, and I'm interested to hear your thoughts on this.
Yeah, I didn't know the egg yolk had that much in it. The yolk is the best part of the egg for sure. These people that just eat the egg whites are really shortchanging themselves. As a matter of fact, a lot of people throw the whites away for some reason. I'm forgetting why, but the yolk is the best part of it. So yeah, I mean, it's great if you can get that much. I'd probably, eat 3 eggs a day, assuming, they digest well with you and do well. But yeah, that'd be just as good as taking a supplement. So yeah, I'm all for it.
Would you be concerned about taking too much? So say you supplement as well as take
No, it wouldn't hurt you. It's kind of self-regulating.
Okay.
It's not the kind of K2 that's going to cause blood clotting and things like that. So,
Okay.
yeah, that's great though. It's a good point. I really wish people could eat their way to get enough vitamins. It's just really hard to get enough of the vitamins in your food these days, at least. But gosh, I was reading something yesterday about these special eggs that came from somewhere in California. I forget. It was a lady that's really into nutrition, organic farming, etc. And her chickens were special chickens, but her eggs, which are way more nutritious and probably better tasting than the normal eggs, cost $20 a dozen. It's a
Really?
high price for eggs. Yeah.
That is a high
Um,
price.
$20. Probably the best way to do is just, you know, get your own chicken coop. One night we actually had a
I
couple of
remember.
chickens on here. Remember that?
I do. I do.
But yeah, feed them the proper stuff because um, even pastured chickens are fed stuff that's probably not the most nutritious things. And this lady, I forget what she fed them, but it was just amazing the quality of these eggs. Makes me want to try one. But I'll have more. I'll tune in for more information on that.
That's interesting.
Um, yeah.
And I think that, uh, more and more people, I think, are becoming concerned about, clean eating and stuff like that. So I think that sort of thing, we're going to see more of it.
I still think eggs are probably the perfect food. Or even better than that is grass-fed beef liver. That's
Yeah.
probably the most nutrition-packed thing you could eat, which I eat occasionally.
That is super interesting and great question around eggs. And I'm going to kind of interpretate your answer here or interpret that in this case, you're saying you don't need the K2 to supplement with. So
Right.
just take the 5,000 of vitamin
Yeah.
D3 along with your eggs.
Yeah, that'd be fine.
Cool.
But it wouldn't hurt you if you took the extra K2 as well.
All right. John on YouTube, I see your question. I love that question around water. Linda, I see your question. Love that. As well as Velma. Thank you guys for putting those questions in. If you got a question for Doc, go ahead and put them in there. We're going to get to them in just a second. And then we're going to get to, let's see, this one came over on Instagram. What is a good supplement for arthritis pain? Super interesting.
Yeah, that's a great question. The ones I take, because I'm old, I definitely have some arthritis. Turmeric, which is curcumin, in supplement form is number one with me, probably. MSM, chondroitin. I also take a collagen supplement. I think helps a little bit. And I'm a big believer in a daily aspirin, low dose aspirin for a lot of reasons. Not only to tamp down that inflammatory index, but also it's a good cancer preventer, believe it or not. So those would probably be the best three. Omegas probably help. Gosh, there's a lot of other esoteric ones out there, but I think those are my favorite.
Would you say take all of them, or is there like an order in which you would choose from that?
It just depends on how severe the problem is. If you take turmeric and it's you don't need anything else, just do that. Just add them one at a time. But I really turmeric, then probably MSM, then chondroitin. I don't know why I'm not thinking of some of the other ones right off the bat. Collagen, omega-3s. Glucosamine's not supposed, it really hasn't been shown to be that effective. So I like the MSM by itself rather than glucosamine with chondroitin and MSM. That's where your money is in the MSM, I think. But good hydration, movement, those type things. Very good for your joints.
One other thing I'll mention here, just because I like to kind of, I think it's fun to clue people in on what I see you guys doing, and Mom does that Avicen quite a bit, and I don't know if that's for. I know she had she had some arthritis in her hands, and that seemed to have helped a little bit with her. So I think that's also a cool thing, but it's not a supplement.
Yeah. Yeah.
So super interesting.
Hyaluronic acid supplements
Yeah.
are pretty good. HAs. So
All right, we're going to keep moving here. This question came through email. Where do you like to see estradiol for 60-year-old males? If estradiol is high or low in a male, what does this mean? I'm going to kind of reference back to your conversation with Diana this morning. You guys both mentioned that when you check an estradiol level of a 60-year-old male and female, a lot of the times the male's estrogen level or estradiol level will be higher than the females.
sometimes, yeah, if the patient's obese and the woman is in menopause and has no estrogen replacement, then I've seen that a lot. Both men and women need estradiol, just like both men and women need testosterone. So in a male, obviously, I like to keep their levels on the lower side. Probably, they say anywhere from 20 to 30 is the best number. I think 30 is a really good number. I used to be more aggressive with trying to get estradiol levels down than I am now with aromatase inhibitors. But I usually I really won't put you on that unless it gets pretty high, like an anastrozole and that type thing, in the 70 range. Otherwise, I like to use zinc and DIM or broccoli extract to bring high levels down. Men need some estrogen for heart protection and for bone health. But you don't want to get it too high because it can cause other bad side effects, including prostate problems. It's not testosterone that causes the prostate problem. It's getting your estrogen level too high. And you can get gynecomastia and probably an increase in heart disease if it's too high. Now, if you get it too low, if you get it below 10, I don't like to see it that low because you lose your heart and bone protection mainly, and probably also cognitive function. Estrogen is important for that. A lot of times I see a man that comes to me initially with very low T, not on replacement, and he usually has a really low estradiol level as well. So some of that testosterone, when you replace it's going to aromatize into some estradiol, which is healthy. You just don't want to get it too high for sure. You don't want to block it down too low as well. So I tend to use more of the natural stuff like zinc, DIM, broccoli extract, those type of things. But that's a great question.
So you're saying less than 10? Is it less than 10?
Ideally is about 30.
Ideally is 30.
You don't want it less than 10. You don't
Okay.
want it really less than 15 probably.
Okay.
But usually if you're getting if it's that low, you usually have low T along with it. You replace the testosterone and the estrogen bumps up a little bit to where you want it.
Okay.
You just have to watch it.
It's a great question. It really it brings to light just how complex hormones are. It really is. When they say balance your hormones, that is the truth. I see. I'm going to put this up here from Michelle. It has to do with our last question. Tart cherry pills. I'm assuming this has to do with arthritis.
Yeah, or drink it too. Yeah, tart cherry is really good for arthritis.
Thank you, Michelle, for putting that in there. Jasmine, I see you. Jasmine, our esthetician in West Knoxville. So glad to see you in here. I see Carter's in here. Carter, thank you so much. I know you guys had a busy day today. Thank you for hanging out tonight. I see coal miner's daughter, Dickinson County. What's going on? Great to see you. We're going to keep moving here, and we'll get to live questions here shortly. This one's another hormone question. Is there an increased risk for cardiovascular events when taking testosterone replacement low T? My dad died in his 80s of a heart attack, and my oldest brother had one at 60. Goes on to say, I took testosterone for low T for a year and felt great, but stopped because I was worried about cardio events. I had a stress test done and had great results. So just wanted your opinion. So it seems that that this listener is a little worried based on family history. What's your thoughts on this?
Yeah, that's a great question. I had that same question in the office today. That's really interesting. I'll tell you about it. But no, testosterone does not cause heart disease, and it does not cause prostate problems either. You have to know what you're doing. But just like I said, if it's aromatizing too much to very high estrogen levels, it could increase your risk slightly. And you also, when you're on testosterone, have to watch your hematocrit, your red blood cell count, because it can thicken your blood up, which is usually a good thing. But if it gets too thick, it makes your blood too sludgy. So you need to donate blood if that happens. Probably 5% of my patients need to donate blood occasionally. So you keep a good eye on your estrogen levels, keep a good eye on your hematocrits. And actually, testosterone is very good for your heart. Think about who has heart disease? Men with low T. So it's very protective of your heart. As a matter of fact, you have more receptors for testosterone in your cardiac muscles than you do in your testicles. So that's very telling. So, unfortunately, a lot of cardiologists don't like it when you're on testosterone, mainly because they don't know much about hormone therapy. So that's an old, outdated concept, just like it's an outdated concept that testosterone causes prostate cancer. It does not cause prostate cancer. If your estrogen level gets too high, it could increase the growth of the prostate. But no, it doesn't cause it. As a matter of fact, today I went over with the guy. He needs a joint replacement, and he needed pre-op clearance from a cardiologist. The cardiologist noticed that his blood was a little bit thick, and he noticed he's on testosterone replacement. He took him off of it because of that. When all you need to do is donate some blood, it doesn't increase the risk. Like I said, as long as you know what you're doing with monitoring levels, especially that hematocrit and your estradiol level. So, I would be more worried about having a heart attack with low testosterone, not high normal testosterone, where we want it. So there's a lot of stuff you can do. You had a heart workup, it's good. Your heart's okay. Just keep your blood pressure normal. Don't develop diabetes. Don't smoke. And you'll be fine. But yeah, get on testosterone replacement. Very protective. Just make sure you do it with somebody who knows what they're doing. That's a great question, though. It's very misunderstood hormones. Kind of like women's hormones are very misunderstood as well. But a good book for you to read would be Testosterone for Life by Dr. Abraham Morgentaler. He's the chief of urology at Harvard. He's kind of the guru of testosterone replacement, and he comes to most of our meetings. But if you read that book, you'll be afraid not to take testosterone. So that's my thoughts on it.
I'm gonna, put myself in this listener's shoes for a second, and just I probably am going to a cardiologist. Like, how do I talk to my cardiologist? Because it's probably pretty influencing if my cardiologist really is like saying, "Hey, this is a bad idea." I might get a little nervous. How do you talk to your cardiologist about stuff like this?
You march right up to your cardiologist and say, "You don't know jack. Did you train with hormones?" I'm kidding. No,
He's
just
kidding.
be nice about it. Just be nice about it and say, "I'm going to Dr. Rogers. I see many cardiologists in my practice that, believe me, I have on testosterone." And say, "Well, I'm really going to leave that up to Dr. Rogers, my primary care doctor who specializes in hormone evaluation and treatment. As long as I keep an eye on my hematocrit, I need to donate blood, not give up testosterone." And, they'll understand it, and maybe even send them a copy of the book, Testosterone for Life. How can you argue with a Harvard professor? But it's just, it's just everybody has their own little niches. And, like I've said many times, doctors tend to be a little arrogant, and what they don't know much about, they poo poo. So obviously he doesn't know much about testosterone replacement and what to do about it. But, sometimes doctors, we're trained to do no harm. Well, that hurts a lot of people, because that means you're not going to do anything good for the patient either. You're not going to take any risk. You don't know what you're doing, do nothing. Kind of like the COVID situation. We don't know how to treat it. We're doing nothing. Come back when you can't breathe. We'll put you on a ventilator. So you have to look at that with a, kind of a skewed eye. So go do your research and make your own decision. This is your body. The guy that his cardiologist took off the teeth felt awful. He won't heal as well from his joint replacement either, unless he's on testosterone. So I put him right back on it, and he'll be happy.
I love this comment from Karen, because I would feel the same way, so there's definitely tactful ways to go about it, to where you can still, have a good relationship.
I'm very tactful about it. I'm kind of kidding about that, but yeah, I always want to keep a good relationship with the cardiologist and all specialists. But, doctors have their place, and if they don't know a lot about something, they shouldn't be giving you advice. They should go, you might want to go down to performance medicine and ask them about it, and let them manage it. So
it's such a good question, and I really appreciated this, because one, I know that this sort of scenario is one of the couple of different common scenarios that turns people off of hormones, and it really is a unfortunate.
What the Women's Health Initiative did for women, denying a whole generation of women from hormone replacement therapy, was just sad. But anyway.
Thank you so much for that question. Thank you to everyone who sends questions in during the week. That always kind of brightens my day to see some of these questions come through. We're going to get to the live comments here. I see Terry's in here. Terry, welcome in. Edna, great question. Lisa, what's up? Great to see you. Anthony, what's going on? Tracy, welcome in. Good evening. Gosh, so many friends in here tonight. We love you guys. If you have a question, we're going to get to every single one. We're going to start with One Step Forward here over on YouTube. After eating a whole food diet and seeing the results in the downfall of processed food. Okay. What about our pets? Would they not benefit from a whole food diet? Thanks for the podcast. Merry Christmas. Merry Christmas to you.
Yeah, Merry Christmas. Definitely. I mean, your pets are very important, and gosh, they can get a lot of junk food. I've talked to our vet about that, and they're huge on that. If you feed your dog junk, they're going to not be healthy. So I agree. I'm not an expert as far as what to tell you to feed them, because, dogs definitely have different types of stomachs than we do. But yeah, talk to your vet. There's a lot of dog food out there that's kind of based on a whole food diet, not processed. So very important. If your dog is sick, it's usually because of what they're eating almost every time.
Yeah.
So great comment.
Thank you, One Step Forward, for putting that in there. I'm going to put this up here. One, because I didn't realize this, Alyssa, but you are in the absolute perfect place. And one, because Dr. Rogers has been a parent of a type 1 for, 25, 26 years. A long time.
Well, we have 2 type 1 children. And it's a hard diagnosis at first to kind of accept, but there's a lot worse things, believe me, and it can be managed, especially these days. But you really might want to go to my son Andy's channel.
Yeah.
Andy's my partner, and he's great with kid diabetics and talk. He'll be glad to talk with your son. And so actually, Andy is an amazing diabetic provider. He lectures to medical students and residents, and they send him down to Atlanta and different cities to kind of teach about diabetes. he was interested in diabetes way before he came down with it,
Yeah.
because his sister, they're very close in age, very close to her, and when she came down with it, he went to all her appointments, and I remember he even made up jars and took them to the local stores in the mall and donate to Juvenile Diabetes Association. And he went to Washington as a juvenile diabetic representative
Yeah.
before he was a diabetic. And then I remember the day I diagnosed him with diabetes, because he was very weak and had the typical symptoms that came on very suddenly after he ran a 8K race. And so I checked his sugar, and it was 900. Of course, I told him, Andy, you're a diabetic, just like Kelly is. And he knew what she had to go through. And he said, great. And not great, but great. Like he was happy about it. And I said, did you hear what I told you? You have type 1 diabetes, like Kelly. We got to start giving you insulin now. And he says, great. Now I can help Kelly more, and that was a true story.
Yeah.
By the end of the night, he'd had every box of food labeled, how many carbs was in it, etc. And since that time, he's been really up on everything diabetes. His diabetes, knock on wood, has always been well controlled, and he's traveled all over the world. I mean, he's very knowledgeable about diabetes, especially he's done some diabetic skits for kids. He even wrote a musical about a kid coming down with diabetes. It's called Andy and the Beats.
Yep.
You could Google it and you could download it. Andy and the Beats. It's the exact story of a young boy coming down with type 1 diabetes.
Yep.
And it's a very good, it turned into a musical.
Yep.
He wrote all the music, starred in it, and it turned it into a book as well. So he'd be glad to send you a copy if you can't find it. But or talk with your 13-year-old.
I'm just so glad that she's here, and we'll answer any question that you have, and one from a parent's perspective, and also from a provider's perspective, and Doc and Andy. So thank you for being with us, and we have tons of resources for you if you need them. We're going to keep moving here. We got lots of questions. I'm going to go to John here on YouTube. What about benefits of alkalized, ionized, structured water? Water is a hot topic right now. Should you drink tap water? Should you not? There we go.
Just got handed Annie in the Beach. Yeah.
There we go.
Give us your address. We'll send you a copy.
We'll send you a copy, Alyssa. We'll send you a copy tonight.
But anyway, about water. I don't claim to be the world's most knowledgeable person about water. I think the benefits of alkaline water have a little bit been debunked. I don't think you probably need especially alkaline water from what I've read. Ionized, probably a little better. Structured water, I don't know much about it. You have to do a little digging on structured water, but there's going to be pros and cons. There's a lot of people believe you should drink, your body's too acidic and you drink alkalized water, but the reports I read says it doesn't help all that much. I may be wrong. I may not have researched it thoroughly enough. So you probably have more knowledge than I do about it. But I'm going to have to look structured water up.
Have you heard of, my best friend texted me actually this today. He was, have you heard of hydrogen water? And he said, apparently it's like the new thing. It's where they electrically charge the water to release hydrogen. Have you heard of hydrogen water?
I think that's what ionized water means.
Is that what ionized water is?
Yeah. Yeah.
That's interesting. It's apparently a new thing.
Yeah. There's a lot of talk about it. And I think the promise of that's probably better than the alkaline water, but, there's a lot of talk about it. I don't know enough to really tell you if I recommend it or not. I certainly believe in filtered pure water. So that's what we use here. But great question. We'll look into the structured water a little bit more.
We do need to look into to water, just the different types coming out and the importance of, like you said, what's it now, the Brita, the
Yeah, the
filtered.
one I have is the Brita. The one I have is better than the Brita. I'll have to get the name. Clearly filtered, I think, is the name of it. It takes out everything, chlorine and fluoride, all that stuff.
Super interesting, John. Thank you so much for bringing that up. We're going to do more research around this, and we'll bring it onto the show. Linda on Facebook is asking, what are your thoughts on Vespa? Are there any cheaper options? I'll be honest, I don't know what Vespa is. I don't know why
It's a good motor vehicle, motor scooter that they make in Italy, I think. But
I knew you were going to go there.
they're expensive. They're expensive. I have ridden a Vespa. If you can, Linda, be a little more specific about what you mean by that. I know you don't mean a motor scooter, but
Vespa.
You're gonna have to. I don't know why it's not ringing a bell.
Linda, give us a little more context around Vespa, and we'll get back to you. I'll come back to your question. We're going to go to Velma. What is the best food for fatty liver?
Best food for fatty liver. The best food for fatty liver is probably, believe it or not, cutting out carbohydrates and getting on an organic, non-processed diet. I think if you eat good fats, it's not going to bother you, but probably, I always tell people, lose weight, don't drink alcohol, don't take Tylenol, get down to an ideal body weight, and take some supplements like milk thistle and NAC. There's even a lot of great evidence that if people are overweight, that the new GLP-1 agonists like Ozempic and the new GLP-1 and GIP named Mounjaro will reverse non-alcoholic fatty liver disease. So I just say getting on a good, clean, low carb, moderate protein, moderate, good fat diet, and get on the supplements as well.
I hope
Great
that
question,
helps. It's a great question there, Velma. In a couple of different episodes we've done on the GLP-1s, that always comes up, the effectiveness it is for fatty liver, the Ozempics, the Wegovy's.
Don't eat sugar. Don't
yeah.
eat sugar.
Linda's given us some context here. She's saying for high triglycerides. So it seems.
Vespa. Yeah. Okay. Yeah, I think it's called by another name that I know it, but yeah, I think that's a prescription omega-3. Yeah, there's a lot cheaper options. Those things are expensive, and your insurance won't cover them. Yeah, I mean, I just get a really good quality krill oil. There's a lot of different companies. Orthomolecular makes a really good one. But yeah, I wouldn't put the money out for Vespa. Just get a good quality krill oil and get a Cleveland Heart Panel and look at your fatty acid analysis when you get on that and see where you're at. And make sure you look at your linoleic acid levels too on your fatty acid profile to get those bad omega-6s out, like linoleic acid from cooking with things other than coconut oil, maybe really good olive oil, and leaving out seed oils and vegetable oils. But yeah, if your insurance isn't paying for that, I wouldn't pay for it. Way cheaper way to go.
Thank you, Linda, for helping us on that one. I hope that helps you. Let's get to Roel on YouTube. Doctor, I've been taking a Boswellia serrata supplement and seem to be helping with my feet pain. Any thoughts on this supplement? They say it works like an NSAID. Have you heard of this one?
Yeah. Yeah, we pronounce it Boswellia, not Boswellia. I'm always making fun of Ben for pronunciation.
I'm always
of some of those things, but
I'm always due for between 1 and 5 mispronunciations.
that was pretty good effort, though. That was a good effort. Yeah, I mean, that's a really good anti-inflammatory. I should have mentioned it when somebody asked me earlier about that. Yeah, I mean, it does work kind of like an NSAID and kind of like curcumin does, but yeah, there's a lot of other benefits by that as well. Some people think it's really good for helping viral illnesses as well. So yeah, I think it's good.
All right, Roel, thank you for that question. Let's go to Karen over on Facebook. Let's see here. I recently made changes to my morning workouts before work, and it's been fabulous. Asking recommendations on eating and vitamins prior to workout. I've learned I can't eat anything but a banana without getting sick. If my goal is to burn fat, should I avoid food until after workouts? But will I have the energy to finish an hour cardio class and strength training? Orange Theory, we're huge fans of Orange Theory. After workouts, my go-to is protein, 30 to 45 grams within 30 minutes. But I'd really like to see, it seems more something. And if I'm missing something here, but I think you can give us some.
Yeah, I think the problem is that I do like the early morning workouts. And if you can do it on an empty stomach, I like that better. But it is tough if you're doing weights and maybe Orange Theory. It's tough without some carbs. What I like to do is, of course, I like methylene blue before workouts. And, you're still in ketosis if you're taking methylene blue. So a lot of times if you want to burn your own fat, you'll go do the intermittent fasting, but it's tough on some people to do that. It depends on how insulin resistant you are. But definitely, I wouldn't take my vitamins on an empty stomach. Most of them, I would wait for lunch to take those. I take mine with lunch and supper. And of course, my nighttime stuff like my aspirin, my magnesium at night. But I don't really like bananas much for a lot of reasons. But they taste good, but they're really high in sugar. Bananas is one of those fruits is pretty high glycemic. Bananas, grapes, mangoes, melons. Maybe if you have to eat something, I'd recommend some berries. Try that. And maybe even if you have to have something, get a little peanut butter or almond butter and see how you do with that. I love methylene blue before workouts.
And I'm kind of reading it as it seems that she might do better without eating. It seems that she can't eat anything but a banana without getting sick.
Yeah.
So it seems the food before.
And it sounds like her energy levels wane towards the end of the workout.
Yeah.
She doesn't eat anything.
Yeah.
Which can be true.
Yeah.
But
the
practice
methylene
around
blue,
a little bit.
The methylene blue would help with that because that apparently gives you good energy. Yeah.
It's energizing for sure. That's my pre-workout deal. Actually, what you could do is get a drink, put some perfect aminos in with some methylene blue and mix it up and drink it before your workout and see if that doesn't help you a little bit. Trying to see what else you could add to that. You could even add some creatine to that. That's what I do. That's the 3 things I put in water and none of them are going to break it fast. The amino acids are already digested. So you might try that little combo, Karen.
And this kind of goes with Karen's question from Anthony. It's similar. Are things like aminos and collagen okay to put into hot coffee, or will the heat break down either of those? So it seems that this is in the morning. Aminos and collagen.
Yeah, I think it's fine. I think it's fine. You know, especially the perfect aminos, they're already broken down. Sometimes I even put creatine in my coffee.
All right, Anthony, I hope that helps. Thank you for putting that in there. Karen, I hope that helps. If we need to clarify anything, let us know. They'll get to, let's see, Alyssa on YouTube. This is a diabetes question. What suggestions do you have to help stabilize blood sugar in a child that is recently diagnosed with type 1? The plan is to get a pump. What's your thoughts on this? Would you immediately put them on a pump or keep them on shots?
Yeah, of course, the plan is to get the pump. They're way better and a continuous glucose monitor. And that's what makes being a diabetic way easier than it was when my kids came down with it, or even back in the days I first started practicing medicine 40 years ago. We didn't even have a glucometer. We had to check a urine to see if they were spilling sugar, and either yes or no, maybe a little bit of a level on it. But I mean, we had no clue. We didn't have A1Cs. So you're just basically giving insulin and hoping they didn't get too low. But of course, as a type 1 insulin dependent, you have to have insulin. And a lot of times there's a little honeymoon period when they don't really even require insulin. But it sounds like you're going to have to go ahead and give insulin. I'm sure you are, but watch their diet really closely. That's one person that needs to eat more frequently and check sugars with the continuous glucose monitor, which hopefully you have. It's just a whole new ball game. Check your sugar every minute. And you need to watch out more about getting too low than too high, because it's somewhat more dangerous to be way low than too high. I'm talking moderately high, not
Right.
DKA high. But and again, but you could survive a long time with hypoglycemia, but just if you got in an accident or something,
Right.
it'd be bad. But for a kid, you have to monitor them a lot. I mean, you have to wake them up in the middle of the night and when they first get it, and kind of see. Now that you have the CGMs, continuous monitors, you could just see what it is without waking them up, because you just don't want them to, get too low. And hopefully they get symptomatic when they get low and can recognize a hypoglycemic episode. But have to have insulin. And again, there's a lot of new stuff on the horizon. Recently diagnosed with type 1, there's a lot of even trials you can get into. There's a lot of evidence that maybe you can prolong that honeymoon phase with some different things. But the plan is to get a pump, make sure you have a continuous glucose monitor, have to have insulin. You have to have a really good diet. I put anybody on a diabetic diet. I mean, that's the kind of diet you want for anybody.
Yeah.
Whether you need to feel good, lose weight, whatever. It's a diabetic diet. I know it changed what we ate as a family all the way through.
What does Andy always have around for when he gets low? Is it always like
at performancemedicine.net?
I just got a note here. If you want a demo or podcast information on any diabetic subject, email Andy at performancemedicine.net.
Yep.
You can get information.
We'll use these for more topics for Andy. We'll put out very detailed videos on this, because it's a very important topic to go deep on.
They need a lot of hand holding at first. They really do.
Yeah. So thank you, Alyssa, for that. And it's again, it's Andy, ANDY at performancemedicine.net. We're going to keep moving here. We got a couple more to go. I got to see where I'm at. Apologize. Okay, let's go to Lisa here. Since I added K2 to my calcium daily, I feel like it has helped my knee joint pain and my hip pain. Is that possible? I've been taking it for many months now.
I don't know why it would actually help your knee pain. Although it theoretically could, because the purpose of K2 is to allow the D to bring the calcium into your bones, not your joints or your arteries. So yeah, I mean, it's that you should be doing that anyway. So that's, nobody's ever really told me that, but it's a really good thing to know. But in theory, it should work that way. So, and the D itself could help as well. Hopefully you're checking your D levels and seeing.
All right, Lisa, I hope that helps. Let's get to, it looks like I missed this one. Edna is asking, is it okay to take meloxicam and naltrexone together?
Yeah, sure. Yeah, they work. They're not, naltrexone is, I don't know if you're taking high or low dose naltrexone, but, it's an opiate blocker. But, meloxicam, Mobic is not an opiate, so you don't have to worry about it. You shouldn't take naltrexone with an opiate, but that combination is fine.
All right. Thank you, Edna. We're going to get to Josie on Facebook. Is glucosamine and chondroitin beneficial to take, or just take calcium and K2?
The glucosamine in studies hasn't shown to be that effective. Chondroitin maybe a little bit more so, but like I said before, I like turmeric, I like MSM better than those. I like the omegas as well. And as far as the calcium, I don't believe you need to take high doses of calcium, certainly vitamin D with K. But you can take too much calcium. Most of the time, I just tell people to get their calcium in their diet through eating green vegetables and things. Extra calcium could cause problems like kidney stones, and it's probably the K2 that's doing you the benefit. But check your D levels and see what that is too. And it sounds like you're doing pretty well with that. So I'm not as big on glucosamine chondroitin as I am some of the other ones. But great questions. We're getting some great questions tonight, man.
I tell you what, I say this every single week, but the crew here on the live Q&A show is so darn smart. I can't help but get smarter every time we do this. So guys, keep it up. Thank you so much for these questions. We're going to keep going here. And it looks like Helen's got a question on Facebook. How can glucose levels be high if you are on a carnivore or paleo diet? No prior high glucose levels prior to diet change. What's your thoughts on this?
Yeah, I mean, if you eat too much protein, it can turn to sugar, believe it or not. So there are different levels. So you might want to. I like a carnivore diet. I like paleo, but you could overdo anything. I mean, and your body has a way of turning excess fat or protein into sugar. Your liver may be, because maybe you're not getting enough, it can pump out some sugar too. So what you probably ought to do is, of course, look and see how insulin resistant you are by getting some blood work to see, and get a continuous glucose monitor and see, what they are 24 hours a day. If that particular high protein meal bumped your sugar up, you'll know what caused it. That's the advantage of getting these GCMs right now. I mean, you can really tell. You can correlate what you just ate to what your sugar did. And people are different too. I mean, gosh, you really could go keto almost and sometimes see spikes in your sugar. And you don't want those postprandial blood sugar spikes, meaning after a meal. So get a CGM and see how much protein and get that right balance of fat, protein, and carbs. I believe that most people don't need that many carbs. I'm not one of these that says you need 50 to 60% of your diet in carbs. I don't believe that. But like I say, everybody's different. Depends on your activity levels, your basic metabolic rate, how much muscle you have, how much visceral fat you have. That's why that in-body comes in handy to see where you're at with that. A lot of those things. So, yeah, certainly could. Certainly could. I mean, you may be a diabetic as well. So look at those numbers. A1C, C-peptide, insulin level.
Helen, thank you so much for that question. Super interesting question there around a low carb diet like the carnivore or paleo. Let's see. I'm going to find where I'm at here. Let's go to Dave around a migraine question. A very common question we get. What are some root causes for migraines and effective treatments? Thanks for doing the show. Thank you for being here, Dave. Thank you so much. You always ask such thoughtful questions. Thank you.
Yeah, migraines are headaches that are caused by mostly your arteries get dilated. That's why they throb. They're usually one-sided, throbbing. You might have visual disturbances. You might have some other weird symptoms. Sometimes you get an aura, you smell something different or see flashing lights, a migraine may hit. But they're common. They're common more in women. They're common more. They run in families. Hormones have a lot to do with it, especially in women, mainly in women, because of fluctuations in their progesterone levels, mainly. I put a lot of teenage girls on progesterone for that very reason. But, there's triggers. Nobody knows what the root cause is, I don't think. But there's certainly triggers. And triggers could be anything from the types of food you eat. Some people have smells. A smell of perfume can trigger a migraine. Fluctuating hormone levels can do it. Change in atmosphere. Even stress can bring on a migraine. Lack of sleep can bring on a migraine. But once you have a migraine, you won't forget it because it's a pretty severe form of headache, disabling in a lot of cases. So really, hormones are I would say the most common root cause, fluctuating hormones of migraines. It used to be back when I first started practicing, somebody would come to the office with a severe migraine, debilitating. These are the kind of headaches that put you in bed. A lot of times you vomit with them and can't see very well, and they can be bad. We used to have to bring them in, give them Demerol and Finnegan and send them home with somebody else to sleep it off. Now, when the triptans came in like Imitrex and Maxalt, that was a lifesaver for a lot of people. And now we even have better medications that don't have quite the side effects of some of the triptans, like tachycardia and all those. There are medicines like Nurtec and Ubrelvy, and they work amazingly well without making you drowsy or anything. The triptans, you could function with them too, but it seems like these new generations are better. There's even some medications that you can take on a daily basis for prevention that we sometimes use. Sometimes we used to use beta blockers a lot or calcium channel blockers. Now we have a new type that Quvivic type drugs that work pretty well. But sometimes even they use Botox to put all around your head and scalp and neck and to prevent migraines. So there's a lot of new treatments for migraines, but mainly, learn the triggers of what causes them and the earlier you get in, the earlier you treat, the better. And there's all kinds of different ones, classic, common, clusters, but they're pretty common.
And triggers are different for different people. So just learning what your unique trigger is.
Yeah. Triggers, maybe a food, a smell, bad night's sleep.
I'm seeing
atmospheric
D-Lynn.
changes.
D-Lynn is saying bright lights sometimes kind of trigger her. So thank you for putting that in there, D-Lynn.
Yeah.
Super common. Thank you, Dave, for putting this in there, and hope that helps
Yeah.
a lot of people here tonight. I'm going to get, let's see this drug shortage question from Mark. Nearly 200 current drug shortages reveal that 84% affect generic drugs, which make up 90% of U.S. prescriptions. Life and death consequence of these shortages underscore. What are your thoughts? You talked a little bit about this with Diana Harshbarger on the Common Sense MD today. How are you looking at it? What's your thoughts?
Well, we've got to get independent from China is the main thing. We need to manufacture our own drugs here. Like I was talking about with Diana Harshbarger, most of our drugs come from China.
Well, she was saying the active pharmaceutical ingredients, the APIs.
Ingredients come from China.
Yeah.
Yeah. I mean, we have the capacity over here to do it. Like, if you watch one of the Republican debates, Nikki Haley says, we've got a place in Bristol, Tennessee that can churn out 100,000 amoxicillin tablets an hour. And yet we're getting them from China still. Why? So there's a lot of questions about that.
Yeah.
Some of it's politics. Some of it's heavy reliance on China through the years, for cheap stuff. But we've got to just change the way we manufacture these things. Where we manufacture them, and there's no way we should have all these drug shortages. It's poor management, for one thing.
Do you think it kind of leads to, you mentioned this morning again, the importance of the compounding pharmacies? Do you think,
they've stepped in, the compounding pharmacies step in, and I mean, so it's not just hormones or compounding or pain creams, it's all kinds of stuff.
Yeah.
From life or death stuff like you talk about. I mean, Johns Hopkins and Cleveland Clinic, they rely on compounding pharmacists.
Yeah.
So whether it's a unique thing they're compounding or just stepping in and making more amoxicillin or something that there's a shortage of, that they're essential. It's sad that the FDA comes down on them so stringently. But that's our system right now.
Mark, thank you for teeing us up on that. It's a great topic, and one that goes really well with the episode we put out today on the Common Sense with Diana. Thank you for putting that in there. I'm going to put this up. Let's see, from Max here on YouTube. Did I hear right a few weeks ago that you're taking insurance now, or a certain office is taking insurance? No, none of our offices, no performance medicine has ever taken insurance, and still doesn't, and won't ever.
Hopefully not. Yeah. Yeah. Now, for office visits, now we have labs that file your insurance. If we order an X-ray, or that gets your insurance, and and a lot of times we deal with PAs and all that. But for office visits, we do not take insurance because we don't want to have to see 40 to 50 patients a day a piece and give you 5 to 7 minutes to spend with you. We just can't do good medicine that way. Believe me, I did it that way for many years. And, and nowadays with all the electronic medical records and the hoops you have to go through, it's just impossible to deliver great quality primary care, in my opinion, taking insurance. If they do great quality care taking insurance, they're probably not going to make a living doing that. But we're very see-through. What the prices are. They're very reasonable. And like I tell people, if you can afford to eat out a meal once a week, you can afford to see us. So it's not that expensive. So, and it really has been great for our practice too, because when I first 18 years ago formed my own practice, and I really decided what I didn't like about practicing medicine. I love being a doctor, but I got burned out on the way I had to practice medicine. That was rushing the patients through, writing a script, see you in a few months, and not really getting into the root cause of the problem. That's why I did the fellowship in integrative medicine. So what happened to me? So I didn't like dealing with insurance companies. I didn't like dealing with managers that weren't doctors that trying to tell you what to do. And I didn't like the EMR. I don't like to be on a computer while I'm trying to talk to a patient. You miss a lot. While you're searching for a code. I mean, there's like 75,000 codes you've got to get just right, or you don't get reimbursed for that visit. So you have to just say the right words, and you're just making clicks, and you're really almost forced to dry lab it, which is what a lot of them do. And so you're not getting a good quality visit usually, not all the time, but
Yeah.
this, again, I'm talking primary care, so that's why I cut those things out. And what happened was I became a better doctor with more time to find the root cause of your problem. I have my own schedule, so I have plenty of time to spend with the patient. Some of it's routine. Some of it really we have to dig deep. And I got better patients. I don't want to fool patients who are going to argue over, is there $20 copay or $15? I don't want that kind of patient. People that come to me want to see me because they're not getting anywhere in the medical system. So I got better patients, and so I enjoy my practice. That's why I'm 69 years old next month. And I have no plans on retiring. I love what I do. That's why I don't take insurance. Briefly.
Well, it's a very interesting topic, and Max, I'm just so thankful that you brought this up, because it gives us the opportunity to even give more and more context around it. Because I see your follow up here with so insurance covers prescription, imaging, and lab orders.
Yeah, right.
And
just not office visits with a provider. Otherwise, we're going to have to rush you out of there within 7 minutes and come home and try to document things we never even did on you. It's just, I don't believe in that. I believe in transparency. I'm really glad you brought that up, though. It's a good point, because unless you did it, you probably won't understand it.
Yeah.
Believe me, every doctor understands it. But most of them just can't do it because they're too tied in to working for a hospital group and having people that boss them around that aren't physicians. So doctors are turning into rats on a treadmill, especially primary care doctors. It's unfortunate, but that's the way our system is going. Fortunately, there's a few people out there that, have the time, and maybe experience helps too, to maybe sort through some things for you.
And I think Max, I'm really glad you're asking these questions, because one, it's we're super empathetic towards the perception of not taking insurance, and we get how it can turn off people, and I think as an office, and all of our offices, we try to find those ways where you can use insurance. It's just something that we don't deal with. We don't interact.
Yeah,
at
you
all
can
with,
file it. We
right.
can give you a super bill file. Of course, you can always use your HSA, which to
Right.
me is the best plan you should do, and really is probably to get a high deductible HSA and spend the money like you want to spend it. And what you don't spend, if you don't need it, you get it.
It rolls
through
over.
almost like a 401k plan. So, I look at the economics of medicine very heavily. I have a master's in business administration. I went and got an MBA. It's really helped me run a business. When I started out, I hung my own shingle 18 years ago. I wish I'd have done it 38 years ago, to be honest with you. But when I did that, it's a learning process. It really is. Most doctors, when they get out today, they can't do it. I talked to one last week. She's a third-year resident. She has $500,000 worth of debt.
Yeah.
And she's coming out as a family doctor. It's going to be tough on her. And she's going to have to work in the system to get money up front. When you do something like I've done, you're going to have to be persistent and realize at first you're not going to make anything to cover your overhead. But, gosh, it's expensive. So anyway, I hung my own shingle out 18 years ago with then I got 2 employees, used 2 rooms. And the concept, it was good timing because everybody's deductible went up. So, mine's all transparent. What you don't want is you have a high deductible and you don't have any idea what your final bill is going to be. Your doctor doesn't have an idea either. Neither does the office personnel. So you're going to get a bill a few months later. It's out the roof because you haven't met your deductible. And plus they have to jack up the prices so high, hoping to get 30 cents on the dollar, that if you're going to have to pay for it because you haven't met your deductible or it's not covered, then you're going to pay out the wazoo. You should have just paid cash in the first place. Kind of like, we have cash prices on a lot of labs. We try to find the right pharmacy for you. I had a guy the other day that I saw from Knoxville. I'd prescribed a medicine for him called Provigil. He goes to CVS, calls me back. I can't afford this medicine. The generic is $750 a month. I go, are you kidding me? So we called around. You can get it at Food City for $35 a month using GoodRx. So I think I understand the economics of medicine, and I'm really kind of you have to be knowledgeable. Plus, you run your own business. You have to you get to know business pretty well, and you understand kind of what works and what. But it's worked. My plan has definitely worked. I mean, when I first hung my shingle, I had a few patients a day. Now, it's just grown exponentially. It's unbelievable, the backup of patients that want to see us. I think my schedule's booked out for 4 months or more probably. And I just get great patients. Usually they require more time, so I don't see nearly the number of patients that I used to see, because a lot of people that come to me, they're not getting anywhere with the medical system, and they want to get to the root cause of the problem. And that's a little bit, more time consuming a lot of times. And sometimes you have to dig a lot deeper with like gut issues and everything else. But yeah, the prescriptions and lab, a lot of people think it's cash only practice. Everything's cash, but no, it's just the office visit. Just talking to us is
and the procedures that we do.
Oh yeah. Like if we
hormones.
did a pellet, or if I sewed you up, or, something like that. I mean, I think, gosh, if you come into my office with a laceration anywhere, I think our charge is going to be probably $150, $180, depending if it takes me hours to sew it up. It won't. But I mean, you go to the emergency room, you're going to pay thousands. It's unbelievable what these ER bills are. So I promise you're getting value for seeing us.
One thing I'll ask just the people who are with us, I think we should put out more content around this, around how to navigate, the system, because it's so complex. Where does my insurance work? Where does it not work? I want hormones. Does insurance cover it? Where does, those sort of things. I really think people need more of that information, because people have no idea, what's happening on the medical practices side. And I think it would help a lot of patients. So let us know in the comments if that's something that would be interesting.
I'm glad you brought that up though, man. It's a great point.
Yeah.
It's a crazy world medically. Navigating that healthcare system is unbelievable. That's why I had those podcasts with Diana Harshbarger.
Well, and like, for example, the thing that I think we probably do the most of is these Cleveland heart panels, and we do of course, the visit that goes over it, but no one would pay cash for a Cleveland heart panel. It'd be way too expensive. So, but it's important that everybody know that the transaction is between the Cleveland heart panel, which is the Mayo Clinic. Quest Labs, sorry.
No, Cleveland Clinic, and it's Quest Labs that runs the test. It's not our lab.
It's between Quest and the patient's insurance. Performance medicine is not involved. And sometimes that can get, confusing. So
yeah, but if you have a high deductible or, plan, you can get, if you need routine labs like a CBC. Sure. I think a CBC costs about $5. A metabolic panel maybe $15. If you file it through your insurance, they're going to jack it up to hundreds of dollars. So if you get stuck with that bill, you're stuck with it. You should ask for a cash price. So know what kind of insurance if you have insurance that covers something, you should use it. But you got to know what they're going to cover, and
Yeah.
those surprise bills you may get, which Dan is working on in Congress. It can bankrupt people.
Super interesting. Thank you. I know we kind of we went on a tangent there, but and I know that wasn't the reason for the question, but thank you, Max, for putting that in there and letting
Did I
us
go on a tangent? Did I get out on a tangent?
I knew you would. I knew you would. I'm like, I saw that question come up, and I'm like, oh man, that's a tangent.
I know. I get on my soapbox because I know the medical system. I know it
We
pretty
need to
well. I
get
used to
this.
remember my dad was an old-timey surgeon. I remember talking with him in the 60s about it. He thought that socialized medicine would come, and it probably will at some point. But he always thought that fee for service was the most fair way to do medicine. And I agree with him. Back in 1960, he would take an appendix out. Your total bill was $100 for the surgery, the anesthesia, the hospital stay. $100 for an anesthesia for appendectomy. Andy, my son got one out in Los Angeles when he lived out there. His bill for an appendectomy is $232,000. Fortunately, he had insurance and they settled for 20. But so there's no transparency. Nobody knows.
It's wild. Let's get to Michelle here. She's been waiting. What do you recommend for nerve pain? My son has severe brachial plexus injury, and nothing
Brachial.
seems to help. Brachial.
Yeah. Yeah, that can be a really hard injury. That's interesting. I don't know how long it's been going on. Or how severe it is. Again, he may have had a neck injury or football injury, maybe. I'm just guessing, but make sure you find out how extensive it is. And then if it's just going to take time to heal, if you need something for neuropathy, 6 months. Yeah. Sometimes we use a medicine called Neurontin. Sometimes we use Lyrica. If it's not that severe, sometimes I just use B6, vitamin B6. It seems to help neuropathies. But, also use of anti-inflammatories probably help a little bit. Curcumin, I like that one a lot. I'd use all the stuff I would use to tampen down that inflammation that he may be having as well. But he may need a little bit of Neurontin, which is a prescription medicine. Inositol is a good one too. Yep. We do use that some.
It seems it was a motorcycle wreck. Man, Michelle, I hate that. I'm
glad he's okay. I'm glad he's okay.
Yeah. I hope that helps him. I see this from Jessica. We're trying to do a little rapid here. Do you see long COVID patients? I'll let you
Every
answer.
day. Every day. Saw
so
several today. Yeah, about 1 out of 4 people that had a good case of COVID have long COVID. That means symptoms persisting over 4 months after you get it. It can range from the 2 most common things I see is fatigue and brain fog, sometimes shortness of breath. But yes, I do see long COVID patients. We use a lot of outside the box things like LDN and methylene blue. There's a lot of good treatments for it. We see a lot of POTS. We see a lot of tachycardia. Sometimes it reactivates. Epstein-Barr viruses can reactivate Lyme. It can just cause all kinds of problems. Yeah, still can't get a deep breath. Try some methylene blue. It's over the counter. You can order it. We have them in all our offices, but it's dirt cheap. I like it. I really do. And, I don't know what your O2 sats are, but you may need to look at that and get some pulmonary function tests. You may have asthma now. And, certainly there's certain types of inhalers, but yeah, you need to be seen and look at that.
Jessica, I hope that helps. And if you want us to, there's some on Amazon you can find too for methylene blue. That seems like to be like the immediate thing you should do. And also we've put videos out around that. We're going to keep moving because I'm seeing some more. I want to make sure we get to most everything. I'm probably missing some. My Armor 15 milligrams, 0.25 is working, but I feel if the doses were increased, I may feel even better. Do you increase dosages? I go to the
Yeah,
JC
sure,
office.
sure. That's the smallest dose you can get. You probably do need to increase it, but check your labs and see if you get too much. You could risk tachycardia, that kind of thing. So, yeah, I like to keep it kind of on the high side. And a lot of times I'll go more by symptoms than a TSH. Of course, you need a free T3 as well. That's where the money is. But yes, that's a low dose. More than likely, you're going to need more. That's a starter dose. That's a quarter of a grain. But yeah. So look at the lab, see where you're at, and yeah, probably will need to go up a little bit.
Thank you, Kristen, for putting that in there. I see Max here sees Robin. That's incredible, man. Thank you so much. Robin is the absolute best. I don't know if she's still in here tonight, but she's in our West Knoxville office and is incredible. So thank you for putting that in there, Max.
She's amazing.
Let's see where we're at. I want to make sure. I know we're kind of going rapid. Lori's asking about methylene blue. We've talked a lot about it tonight. Man, my interpretation is methylene blue is used for quite a bit.
Yeah, everything.
How would you describe it?
We use it a lot. Well, we use it a lot for it's an anti-parasite, it's an antifungal, it's an antibiotic, it's an antiviral. We use it a lot with COVID. Seems like we use it more now for prevention of UTIs. We use it for breathing, better breathing. We use it for energy. It helps cognition. If I'm feeling that post-lunch, down, little tired, fatigue, I take my little methylene blue and it perks me right up. They use it in the ERs. Every ER doctor knows where it's at, because when somebody has a carbon monoxide poisoning,
there we go.
Yeah, don't give it to your dog. That's the only thing. Don't let your dog get into it, because it stains them. Stains your carpet too. But every ER doc knows where it's at, because it will save your life if you have carbon monoxide or cyanide poisoning. They use it intravenously and it saves their lives within minutes. So it's a good oxygenator. It's actually a precursor to hydroxychloroquine. Go to, I do a lot of podcasts, and that's been the biggest by far podcast people listen to is the methylene blue. Yeah, use it daily. I use it daily.
And I real quick, just because we're on the topic here, Michelle's asking the dosage. I'll let you say. I know what I think it is, but I'll let you kind of.
You usually start out for routine use 8 drops a day in a glass of water.
Okay. And like Doc just said, if you search for methylene blue performance medicine, tons of stuff will come up on it. Everything we've said on it would be under that search term. We got a couple videos, a couple different articles. So definitely we're huge fans. And I know I've probably missed quite a few people here tonight. I'm so sorry. I see Mark's question around the pharmacies. We'll get to that. In fact, this could be a quick one. Do you know 100 years ago, weren't many of our medications made by local pharmacy? Would you know that?
Yeah, for sure. That's why the old mortar and pestle that they ground the stuff up. That's how they're all made. Those are the original great pharmacists. Good point.
Yeah. Thank you, Mark, for that. And then Mark is asking, did you ever find much use for Genetian violet?
Yeah, we used to use that a long time ago. Yeah, it really kills a lot of bacteria and things. That's I haven't heard that name in a while. But you pronounce that good too. But yeah,
I'm telling you, I'm getting better by the week, guys. And I'm going to put this up.
That's kind of like iodine. Yeah.
D. Lynn says we were great tonight. What do you think?
Wow.
How do you think?
I think it was good. I think whoever asked the questions was good.
I tell you what,
answer them well enough. But
these questions were incredible, and I know I'm sure I've missed something. But if I haven't, great. Lisa's asking about implanting the CGMs. One, I know we've done a video on that.
Andy's done that. They're easy, simple. Matter of fact, Andy put one on me, and he demoed one. He put on me a Freestyle Libre. So go in and look at that.
Is that something Lisa could do on her own at home?
Yes.
Okay.
Yeah. Especially if you get a Freestyle, it's simple. Now, if you get a Dexcom, of course, they're going to have a rep come start it for you.
Okay. So Dexcom will come with a rep to start it. If you get a CGM, what's the brand of CGM?
Well, Dexcom's a CGM, so is a Freestyle Libre.
Oh,
if you get, so they're varying types. You're probably going to get a more heavy duty CGM, and some of them do a closed loop thing where they tell your pump how much to pump out and all. So it's really, the technology is amazing.
Thank you, Lisa, for that question. And we did a demo video. If you search for CGM's demo performance medicine, that will come up on YouTube. And real quick, I want to put this up. I think I don't know if Alyssa's still in here. I know Jack is. Will somebody send me an email with Alyssa's address? It's ben@performancemedicine.net. If Alyssa, if you're still here, I know we've gone way overboard. Send me an email, ben@performancemedicine, ben@performancemedicine.net. I want to send Alyssa a book, and I'm also going to I'm gonna get Andy to send your kid a video, a personalized video, just giving him some encouragement and letting him know. Yeah, Alyssa's still here. Okay, I'm gonna make sure Andy records a video for your son or daughter, and I want them to know they're not alone. I know it can feel that way at the beginning, but you guys got tons of support. I'll send a video and I'll send a book. So email me, ben@performancemedicine.net. We'll get that out to you.
This is usually our sign that we're signing off. We get the dogs on here. Notice they don't have methylene blue on them tonight. So
real quick, and maybe I can answer this, but I want Lori to get this answer because it's like something that we do so well. I was diagnosed with Hashimoto's 35 years ago. Is it possible to come off Synthroid after all these years?
Here's Ike. He wants to come on the show.
Ike, what's up, buddy?
But possible, yeah. Again, Synthroid is not my favorite one to use. I much prefer NP or Armor. But 90% of my patients just feel so much better on it. But yeah, I mean, it's possible. I've certainly seen it, with changes in your gut and a few things like that. And some supplements. Possible. It is possible. But we look at your antibody levels and all this, and certainly I like to use more the pig thyroid Armor or NP if you've never tried that. Most of my patients prefer it, but yeah, it's possible. One of our PAs is really good with Hashimoto's. That's Margot in Fountain City. The patient asked us that the other day, and her answer is like mine. Yeah, it's possible.
Lori, I hope that helps. We're going to put more content around stuff just like that. I think there is a book you love around Hashimoto's. We've done an article actually where the book might actually be in this article. It's seems that they tried Armor but couldn't get the levels right. Is what Lori's saying.
Okay.
So I don't know. Does that change your answer at all?
No. Still possible to get off of it.
Okay.
Very slowly, if you can kind of find the root cause of it. I mean, it just depends on, again, if you've been on it 35 years, you probably have more parenchymal thyroid damage. Hashimoto's is kind of like a viral illness that wipes out a lot of your thyroid function. So again, that it's possible. Look into a lot of things. Your adrenals are tied up in it. Sometimes insulin resistance is tied up in it. Inflammation is tied up in it. But it's certainly possible. I've seen it.
Lori, I hope that offers some encouragement. Thank you so much for putting that question in there. We get a ton of Hashimoto's questions, so thank you so much for that. Doc, man, I can't tell you how much I appreciate you. Thank you for doing this.
It's been a lot of fun. Thank you, Ben.
Guys, the questions were phenomenal. As always, we're going to be back next week. Tuesday, 7 p.m. We'll be back for live Q&A. I hope to see every single one of you here. I hope you're coming with questions just like you did tonight. If I missed something, I'm going to go over them later on tonight and make sure I didn't. If I did, I'll get them first thing next week. Doc, go do something fun, man. I love you.
Love you, Ben. Good night.
All right, guys, we will see you next week. I'm looking for my outro. Where am I at? All right, see you guys.
Don't go away.